Hello, Marcus Boston here. Quick video today, and I want to talk with you today about understanding some of the key issues that are present when a family is trying to find answers as to the cause of their baby's traumatic brain injury at birth. And in my context, or in this context, this is going to be an HIE and hypoxic ischemic encephalopathy diagnosis. Now, what I want to help you understand is we are talking about birth trauma here. That's the context of this video. So I'm not going to be getting into, whether the baby had a stroke in utero earlier in time, or whether there are developmental issues, or whether there are genetics. That's not going to be for this video. For this video, we are going to talk about the key issues in the birth trauma aspect of things. And I've done a video on this before, a couple of videos, but they're further back on some of my social media pages, and I've gotten a serious increase in followers over the last couple of days. And so this question is coming up, and I just want to put this out here to help families understand, especially the newer followers. All right, so what we're looking at in a lot of instances, there's a lot of things that we're looking at, but one of the big areas of analysis is what notice, if any, were the doctors and nurses or the medical professionals, what notice did they have that your baby may not have been tolerating a vaginal delivery? That is huge to understand, and there are ways that we can do that. And one of the big ones that we're looking at are the readings from the electronic fetal heart monitor. The monitor readings, these are very important because they can help doctors and nurses understand in real time pretty much how well your baby is doing, your baby's fetal well-being. The strips can help with that. And so when we're looking at the strips and we're going through everything, we want to see, were there issues of variability? Were there variability problems? Were there, minimal variability that was going on? Was there tachycardia? Did you have episodes of bradycardia, tachycecily, and a whole host of things? And we're using the strips to get a snapshot, to be able to understand what was happening. And then based on these readings, what did the doctors and the nurses, what did they do as a result of the readings on the monitor? And so notice is very important in these cases. Sometimes you can have instances where the doctors or the nurses, they move, but maybe they moved too late. Maybe things were bad for a considerable amount of time, and by the time they moved, the injury had already taken its toll on the baby. So I'm trying to help you understand in this context some of the key areas of analysis, and notice to the medical professionals, that is very important in these cases. All right, I'll see you next time.